So as you know, today we'll be talking about AI in healthcare sector. So can you tell our audience how has AI been used in healthcare?
Sorry, your audio just lagged.
Hello, am I audible now?
Yeah.
All right. Can you tell our audience how has AI been used in healthcare?
So AI is used in a various ways. Like first is chatbots. Chatbots basically helps you to save your time. Like you can communicate with the chatbots of the multi-specialist hospitals or something, and you can book your appointments or something like that. Second, is robotic surgeries. As robotic surgeries give you more precision and save lots of time also for the diagnosis and all. And virtual nursing assistant, like from far away also, nurse can digital nurse or virtual nurse can assist you regarding your small things, like you can cleaning your bones or something like that. And precision making, as I said, precision is more with AI. Like with AI you can get in details of the treatment or the disease or something. And administrative workflow assistance. As I said, we have to maintain a huge record of all the data, like how many patients are there and what are the diseases. So maintaining all those data will help. AI will help to make it generalized and get more data and easily.
All right. So what are the challenges for AI in healthcare sector?
The challenges are huge pressure on the machines and all, like as we are using all the machines which are maximum of the machines are based on AI. So huge pressure on the machines and all. And you can say we need precision in everything. So to maintain all those records, to maintain all those algorithms, and to maintain all those programs, we need a huge precision, and we have to continuously check that everything is working good or not. And the major thing is the criticism, like all people. So main thing is to face them and work progressively.
All right. And how does AI affect medical diagnosis and treatment? If you could tell us about that.
So means helping patient to, we can help patient to add to save from many diseases. Like a few years back, we are not able to cure cancer or like there's diseases. So now there is a treatment of every diseases we have. So using AI will help in curing all those easily.
All right. And can you tell us about the improvements made by AI in healthcare sector?
Yes, improvement is like we can say, first of all, to keep us well. Many devices are there like Fitbit or smart bands. They are helping us to be fit by daily tracking our activities and setting goals and telling about you everything. So one thing is about keeping you fit. Second is early detection. Like if you have any disease, so AI can detect it very early. Means according to means we cannot AI will help to detect the disease very early and easily. And decision making, like based on the data, earlier data, like how patients were, what were the symptoms of the patient, how are the patients are curing, how are the patients are reacting on the diseases. Based on that, we can get the precision on the data that yeah, this disease may be the reason of the patient or something. And we can say the end of life course, like means you don't have to worry about like how the future will be like or something you can detect according to your behavior, according to your full life, how you live, how you eat, how you walk. So you can detect that this might be the reason of your disease, or in future you might get this disease. So it is easy with AI to get all the things on scale.
Right. And how can it change the future of healthcare?
Future of healthcare. So major thing is like you can say, if a patient is admitting in a hospital, so using few algorithms and technologies, Microsoft is working on a technology that can predict that how, when, or how will patient will readmission in the hospital. Like if a patient is going now, this a patient is not discharged from the hospital. So according to his recovery status, according to his health life, what is all about, we can predict that when he will purely recover or when he will come back to be admitted in the hospital. Second is cutting human errors. Human errors like there might be many chances when doctors or the nurses or the workers make a slight mistakes, due to which there may be a major issues with the health related things, or maybe probably the death of the patient. It may happen. So reducing that and cutting those human errors and managing pandemics. So managing pandemics like will be if like this corona happens. So we can, according to the data, we can calculate that how if corona will happen again, or if we can say corona will come back, or when will it come back. So according to data, we can calculate that when it may come back, or how many people may be affected by it, or what will be the rate of death, or what will be the rate of cure. Yeah, we can calculate according to it.
All right, sir. And will you tell that, I mean, according to you, will artificial intelligence replace healthcare workers?
Yeah, artificial intelligence will guide and will give a second hand to the healthcare workers, but it cannot completely replace the healthcare workers, as we cannot be dependent on the healthcare fully. Sorry, AI fully. So, yeah, it cannot replace completely, but yeah, it will help and it will enhance the quality of the medical life.
All right, sir. Thank you so much for giving out so many information. Do you have any message for our audience?
A message for the audience is like believe on the technology, as many people still doesn't believe that AI will be a part of life, AI will be a part of healthcare sector or something. So believe in AI, it will work for you and good for you.
All right, sir. Thank you so much for joining us today.
Thank you.